Welcome to another surgical ICU video which deals with the respiratory function of the blood, mainly oxygen and carbon dioxide transport. The transport of oxygen in the blood depends on four parameters. First of all, the concentration of oxygen in the blood. Second of all, the rate of delivery of oxygen into the arterial blood. Third of all, the rate of oxygen uptake from the capillaries to the tissues. And finally, the amount of oxygen taken up from the capillaries to the tissues. To make all of this very simple, we all know that the blood has hemoglobin, and roughly the hemoglobin is 15 grams per deciliter. This amounts to 750 grams in the entire human body for a 70 kg individual. The oxygen carrying capacity of hemoglobin is 1.34 ml per gram of hemoglobin. Therefore, a human being on an average will carry roughly about 1 to 1.2 liters of oxygen in his blood. Now the demand of the body tissues is roughly about 200 to 300 ml of oxygen per minute. Therefore, if one stops breathing, the body can survive for almost about 4 to 5 minutes with the amount of oxygen that is carried in the blood. And this is the most practical point that one needs to know as a surgeon, especially when you deal with ICU patients and patients in trauma, that 4 to 5 minutes is the golden period after which there is going to be hypoxic or ischemic changes to the body tissues. And when there is ischemic change or hypoxic change, as you can correlate with your video in cellular respiration, there is going to be an anaerobic metabolism in glycolysis. This will lead to an accumulation of lactic acid, which thereby increases the lactic acid in your ABG. So when there is lactic acidosis, it reflects to you either hypoxemia, ischemia, bleeding, sepsis, shock. The normal PCO2 is anywhere between 35 to 45 millimeter of mercury, whereas the normal PO2 is usually 100 mm of mercury. Now if you increase the PCO2 by 5 mm, which is hardly anything, or if you decrease the PO2 to up to 55, that is when the rate of minute ventilation will increase. This shows you that the body is more concerned with eliminating CO2 as opposed to be worried about the hypoxia. Now the total body water is roughly 40 to 45 liters, and because CO2 is very soluble in water, the total body water carries almost 130 liters of CO2. Once CO2 enters the RBC, it dissolves with water to form H2CO3. This breaks up into bicarbonate and H plus ion. This H plus ion gets out, is exchanged for chloride. Basically the bicarbonate and the chloride gets exchanged. And once this happens, there is hardly any H2CO3 inside the RBC. And this creates a sink for the reabsorption of CO2. And this shows how much the blood can actually solubilize CO2, and the reverse phenomenon occurs in the lungs. Therefore, the body has a very high capacity to wash away CO2. This will also explain to you why during a laparoscopic procedure, when you insufflate the peritoneum with CO2, it's not going to have much of a metabolic consequence. That is depending upon the flow rate, because the body can really wash off a lot of CO2. Thanks for watching. Like, comment, subscribe, email me.